Hi, my name is Hannah Harrington, and I am a nursing student at University of San Francisco. I am currently doing my rotation in labor and delivery at Lucille Packard, otherwise known as Stanford Children's Hospital.
How long have you been doing this rotation for?
I've been doing it since January, so I'm a little over a month into it.
Okay. Can you kind of describe, I guess, who's in the room during the delivery? Who's in the room when this is happening?
I've been able to deliver almost 10 babies now. Me as a nurse or another nurse with me is in there with usually the two parents, and in all the deliveries I've been at, there has been both parents.
So then after obviously the mother gives birth to a child, does she have to come in for checkups, or does she free from the hospital right after she gives birth?
Usually the mother will stay between 1 and 3 days, and then after that they usually come in within the first week just to do a checkup to make sure there's no bleeding or any complications going on. During that time they're also supposed to see their pediatrician within the first week, so that's for the baby. Usually the mother will go in on her own typically, but with the pediatrics sometimes both parents go, but a majority of the time you'll always see the mothers. And sometimes there's support, sometimes from the father, sometimes not, but she also is either breastfeeding, which requires she's either doing that herself or she's breast pumping, so that requires her to be with the baby or not be gone for too long of a period of time. So
You're obviously a nursing student, so you're surrounded by a lot of people your age that are going into a really intensive, time-consuming, time-demanding profession. Do you know any nursing students who are starting families or even considering that, or can you compare, I guess, that to any of your other friends who are considering families in other professions?
Yeah, none of my nursing friends right now and peers are thinking about starting families or having families, just because it's so demanding in nursing for the first couple years and you really have to get settled in your career.
Do you know if paid leave for parental leave is offered in nursing once you become a registered nurse?
So at most hospitals it is unpaid. It just depends on the hospital and what kind of benefits they offer you. And I know maternity leave exists in the hospital, but I haven't necessarily heard of paternity leave, but that just might be from my experience, so I'd have to ask about that specifically. But I know most hospitals it's unpaid, about 6 weeks.
So as a nursing student with obviously scientific background and medical knowledge on what it means to carry a child and deliver a child and take care of a child post-delivery, is there importance in a father, taking paternity leave? Is there value in that?
I think there's total value in that because the mom can't do it on her own. It's so much. She's already been pregnant for 9 months or so, and she has so much stress in her body after giving birth. And she may have had a C-section, so she can't lift things. She may not be able to lift the baby in the first couple weeks, 10 days. That's when you risk the postpartum depression, because they have no sleep and very little support if they don't have a father at home or anyone at home with them to help them. And it's really important that the baby, as they're going through this stage of life, it's called, under Erickson, it's called trust versus mistrust. So when they're crying for something or upset, they need to know that someone's going to be there. And if it's constant, which it is with newborns, and it's just a mother, then they have to constantly be there, and they may not be able to be there all the time. So this mistrust can develop also within the baby, so it can hold back their developmental stages.
Okay. Oh,
Yeah.
no, that's sad. Okay. Paternity, I guess to you kind of
Gives a higher chance of the baby and the mother getting enough support to lessen postpartum depression and the stress on the mother and the baby too.